Fox 5 Weekend Live. I am so excited for this next segment and for my good friend to join me as well. Always willing to be here with us on the weekends. You're going to become a regular, and we're never going to run out of topics. So thank you so much, Dr. Garish, for joining us here.
Of course, I'm glad to join you.
So last time we talked about getting your skin ready and beautiful and perfect coming out of winter, heading into spring. But I want to talk this time because you're really doing something that everybody probably can benefit from, but might not have all the information on, because I feel like it's something that's really becoming a hot topic now, especially with Hollywood. And of course, anything that happens in Hollywood, well, we want to do as well, right? And that's hormone therapy. But when we talk about hormone therapy, instantly I'm thinking of a woman going through perimenopause and menopause. But does it expand beyond that? Tell us what it is.
Yeah, well, I mean, classically, that's what you would think is perimenopausal, menopausal women. And we've had such a tumultuous couple decades with hormones with, some conflicting information. And now just within the last few months, the FDA pulling the black box warning on estrogens, it really has opened things up. But really, when we start talking about hormones, women in their late 30s start to lose progesterone. And that's where you may notice, I'm waking up at 3, 4 in the morning and can't go back to sleep, or estrogen's a little bit more imbalanced and there's a little bit more irritability. So it starts a lot earlier than, it might start 10 years before you start to become perimenopausal.
I went to the doctor the other day for, the checkup we have to go through of mammograms and, gynecological stuff. And they put me down as perimenopausal. And I'm like, excuse me. Like, I want to reject this. No, I've not reached that stage of life. But and so I had to ask them honestly. I was like, what are the symptoms? How do you know that you're going through this, especially if you're saying it's not like a specific age and maybe even an earlier age than some think?
Yeah, and what happens is when we draw blood, it's an instant in time, and your lab values may look fine. It's just, but as you start to get into that perimenopausal, menopausal area, just estrogen starts to fluctuate all over the place. You might see some testosterone levels dropping. Progesterone is definitely dropping. So it's not I woke up one day and all of a sudden I'm here. It's a slow, arduous process. Symptoms can be very vague and a lot of time are classified as this is life. I'm tired, this is life. This is stress, this is life. And a lot of times we just blame other things and we don't look that physiologically there's changes happening in our body.
Okay, so I've always had the sleep issue though. The other night I was up from 2 to 4:30 in the morning. Maddening. Last night I slept just fine through the night though. Is there hormone therapy? Because since you're mentioning that that's one of the symptoms, is there hormone therapy that helps with sleep specifically, or is it more of an all-encompassing thing?
Yeah, it really is truly complex. And, so we can look at it from a physiologic level. What affects that? Well, number one, progesterone. We just talked about that. Number two, as we get older, our body doesn't secrete growth hormone, and that whole circadian rhythm of having an increase in growth hormone in the middle of the morning, that plays a role. Melatonin. In our mid-30s, we start to lose melatonin, and that's when you start seeing everybody supplement melatonin. The problem is most people are supplementing way too much, and they're waking up like a train hit them. And then there's things just life, stress. You wake up and you at 3 o'clock in the morning, and all of a sudden you need to solve all of your life's problems that night, and your brain just goes off to the races. And so it's very complex.
I think I might be doing all of that. I might be guilty. I may be like a perfect candidate for this, and maybe they were right on this perimenopause if that's what it's going to be. But what are some of the other biggest myths about hormone therapy and that people might need to be aware of?
Yeah, and I think that's huge because in 2002, the WHI Women's Health Initiative trial came out, and that overnight, with the media grabbing onto some of the information, everybody jumped off of hormones. They thought it increased cancers, it increased blood clots. But when you look at the studies, number one, some of it was misinterpreted. But number two, people were taking estrogen by mouth, which does increase the chances of blood clots. The progesterone was not bioidentical, and that did increase the risk of breast cancer slightly. So we had not only a whole generation of women, but a whole generation of doctors that are believing hormones are bad. And there's increased risks across the board, whether it be cancers, whether it be blood clots. And that's changing with bioidentical. We know estrogen cannot be taken by mouth. It should be done through the skin, transdermally. Progesterone can be taken by mouth. It cannot be done topically if you have a uterus to protect the endometrial lining. So there's a lot of nuances that we have learned, but you have to look at the number one cause of mortality in women after menopause is cardiovascular disease, number one. And hormones dramatically reduces that risk. And so there is a huge benefit to hormones, and the risks are very, very low.
That was really my next question of what are the risks and then what are the benefits? Aside from what you just said, I mean, is there more to it?
Yeah, well, I mean, the number one killer for women is cardiovascular. And if you add up number 2, 3, and 4, it doesn't even come close to number one. The other benefits are bone mass, hip fractures, things like that as you get older. You've seen a huge increase in dementia. And so hormones are showing a strong correlation in slowing that progression. So there's so much benefit, never mind the quality of life. And we started on skin. The benefits of hormones on skin and just how we look is dramatic as well. And if you look good, you feel good.
Okay, so now it's not just about sleeping. It's also, is it something, the benefit of skin, is it going to help with like collagen, elasticity, wrinkles, or those things that you're talking about when you put it on the skin?
Yeah, well, not only so you can put it on the skin and we can keep it localized to the tissue in the skin, but we can also get the benefits systemically. But yes, it helps build collagen, helps with hydration. I mean, what is one of the biggest complaints that women, as they go through menopause, complain about beyond, maybe the hot flushes and the irritability? It's my skin is dry, my hair is thinning, my nails are. So all of those are directly influenced by hormones.
So how do you know if somebody's a good candidate? Like, what do I need to be like, you know what, maybe it's time to go to the doctor and see about hormone therapy? Because I would naturally think, I don't need this, I'm fine. But by what you're talking about, it's got me asking questions that maybe I need to come in and be like, can we check this?
Yeah. So again, blood levels are a moment in time. So you might be in that rapid roller coaster of rising and falling, and you catch it in time. But a lot of it is symptoms. It's just you can sit down and have a conversation with somebody and hear what they're going through, and you get a strong suspicion of what's going on. And it isn't rocket science that if you have somebody in their 40s or 50s with symptoms that are suggestive of hormones starting to fade, that it's hormones starting to fade.
Are there different types of hormone therapy?
Well, there's different hormones. I mean, hormones is such a broad topic. When we start talking about that, we talk about cortisol, we talk about thyroid, we talk about estrogen, testosterone, and then there's a lot of different ways to supplement it. I mean, estrogen can be done topically. It can be done orally. It can be done troche. We talked about oral. It probably isn't the best way to go. Then you have pellets, and a lot of women are doing the testosterone pellets, and they're doing that every 3 to 4 months. So there's a bunch of different ways that if there is a deficiency, how we can approach it.
And how long? Like, is this something once you start, do you need to kind of continue on as long as you keep going, or is there a part where you don't necessarily might need this anymore?
Yeah, and that's always the number one question that people ask. Is this something I have to do forever? And my answer always is this is like the gym. You go, you work out, and you feel great, and you're in shape. You don't have to do it for the rest of your life, just as long as you want to maintain benefits. And if you're getting that much benefit, those are the patients that come back and say, I don't ever want to get off of this. Please don't ever take it away.
Is it expensive?
Well, no. I mean, that's a relative term, right?
I mean, it's like everything in life. It's going to be a cost, but like hopefully the reward is worth it, right?
Yeah, I think number one, if you took the average person, I think it's affordable. But I think when you look at it as what is the cost if you were to get sick and some of the preventable diseases that hormones can help with, like cardiovascular disease, if you have a heart attack and you're incapacitated or so no, I think it is probably one of the best investments. In my residencies in the 90s, we put every single menopausal woman on Prempro because it was the standard of care and we knew there was huge benefit. Now, again, it wasn't bioidentical and we weren't giving it by the best methods of administration. But now I think we're going to return to that and it is going to become the standard of care again.
What about, I mean, if you want the hormone therapy, it sounds like most any woman that's getting to a certain age might really want to invest in this and in their health. But are there other things that we can do? Other alternatives to maybe our lifestyle or our diet or things that might help out along with it?
Yeah, listen, medicine is great, but it's never the panacea for everything. And then you can just go and lay in bed or on the couch all day eating bonbons.
Why
and
not?
Maybe one day, but not yet.
I will snatch at myself. I had one of those croissant donuts this morning, and I don't typically eat donuts because I'm afraid of them, but I gave in this morning. But I won't do that every morning and be a bum, okay?
Yeah, well, Julie, anybody who knows you knows that you put a lot into your self-care and being healthy, right? And that gives you the ability to do things like that once in a while. It's just not a habit that you do every day. Eating healthy, exercising, all of those things can never be replaced. Hormones help create the foundation. And then there's a whole topic of peptides and how those come in. All of those help support healthy living and making good choices.
So if somebody wants this, what questions do they need to ask? What do they need to be aware of when they go to their healthcare provider and say, you know what, I'm interested in hormone therapy, but I need something that's going to be maybe personalized to me?
Yeah, well, I think the first thing is finding a practitioner that is okay with bioidentical hormone therapy. And like we just talked about, there's a whole generation of doctors that still need to get up to speed. And there's a difference between your labs are within normal limits and what is optimized. And so I think the first thing is finding a doctor that is on the same page, is that within normal limits is not optimized and is willing to work with you and customize a program that fits into your lifestyle.
Okay. I learned a lot there. It's not something that I really wanted to have to, when we're talking about hormone therapy, in my head, I still don't think it applies to me, but it does. It does. And it applies to so many women out there that are in the same age. And to the fact that you said in your early or in the 30s, it can happen as well. So thank you so much for the insight today.
Absolutely. Great to join you.
Okay. We will, I'm sure, talk to you soon because there's so many other topics I want to get to, and you're just a wealth of knowledge. Thank you for joining us. Enjoy the rest of your Sunday, and especially as we're getting into spring. We'll be right back.